Hi everyone. Welcome to our channel. Today we're starting a series of videos on a very important medical specialty, urology, and if you're interested in learning more about the most common procedures along with pre- and post-operative care, stay with us as we guide you through everything you need to know in a clear and easy to understand way. Urology focuses on diagnosing and treating conditions related to the urinary tract in both men and women, as well as the male reproductive system. Urologists treat a wide range of conditions, including urinary problems, kidney stones, urinary tract infections, and prostate-related diseases, such as benign prostatic hyperplasia, BPH. In this video, we'll talk about some common diagnostic procedures used to identify urinary problems. What is cystoscopy? Cystoscopy is a procedure that allows doctors to examine the inside of the bladder and urethra using a thin, flexible tube called a cystoscope. It helps diagnose and treat urinary tract issues like infections, stones, or tumors. Preparation involves several key steps. Medical history: ensure the patient's medical history is reviewed and consent is obtained. Medications: review current medications, as some may need to be paused. Fasting: if anesthesia is used, ensure the patient has fasted appropriately. Hydration: encourage the patient to hydrate the day before the procedure. During the procedure, the patient is positioned on their back. The area is cleaned, and a local anesthetic is applied to the urethra to minimize discomfort before inserting the cystoscope into the bladder. The healthcare provider will visually inspect the bladder and possibly take samples if needed. After the procedure, it's essential to provide the right guidance to ensure a smooth recovery. Hydration: make sure the patient is encouraged to drink plenty of fluids to flush out the bladder and reduce irritation. Pain management: explain that mild discomfort or a burning sensation during urination is common, and over-the-counter pain relievers like acetaminophen can help alleviate symptoms. What is uroflowmetry? Uroflowmetry is a diagnostic test that measures the flow rate of urine to assess possible urinary obstructions and evaluate bladder function. It helps determine the severity of conditions like BPH or bladder outlet obstruction. By measuring the volume and speed of urine flow, it identifies issues such as weak urine stream or difficulty urinating, and can detect obstructions affecting the normal flow of urine, helping to evaluate bladder and sphincter muscle function. A few important actions are necessary before the procedure. Hydration: ensure the patient drinks enough water to arrive with a full bladder. Avoiding medications: some medications might affect bladder function, so review the patient's current medications. The uroflowmetry procedure. During the procedure, the patient urinates into a specialized device that measures the speed and volume of urine flow. It's a non-invasive test that typically only takes a few minutes to complete. After the procedure, a few key actions are necessary. Hydration: continue to encourage the patient to stay hydrated to promote healthy urinary function. Monitoring results: results are usually discussed during follow-up, and no specific post-care is needed for this test. Now, let's move on to the final diagnostic procedure we'll cover today: urodynamics. This group of tests helps us evaluate how well the bladder and urinary system are functioning, particularly in patients experiencing issues like incontinence or difficulty emptying the bladder. Urodynamics is a group of tests that evaluate how well the bladder, sphincter, and urethra store and release urine. These tests help diagnose lower urinary tract issues, such as incontinence, frequent urination, and trouble emptying the bladder. Doctors use urodynamic tests to measure bladder pressure, urine flow rate, and detect abnormalities in the urinary tract. Before the test, it's important to 1. Eat and drink normally. 2. Take any routine medications unless instructed otherwise. 3. Ensure the patient arrives with a full bladder. After the test, normal activities can usually resume. Some patients may experience mild discomfort or a burning sensation when urinating, which can be relieved by drinking plenty of fluids or taking a warm bath. It's important to discuss the results with the doctor to determine the next steps in the treatment plan. In summary, we've covered 3 important diagnostic procedures in urology: cystoscopy, uroflowmetry, and urodynamics. These tests play a vital role in identifying and managing urinary conditions, ensuring patients receive the right treatment. And remember, if you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss out on our future content. Thank you for watching.